Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. Today we'll continue our history taking course, and today presentation on dyspnea. Dyspnea, breathlessness or shortness of breath. My name is Ahmed Al-Hadidi. I am emergency medicine consultant. For causes of dyspnea, we have acute causes, which means less than 1 month. Many causes for acute dyspnea, like aspiration, anaphylaxis, acute exacerbation of COPD, acute asthma attack, acute respiratory tract infection, arrhythmias, anemia, anxiety, acute Guillain-Barré syndrome. Also, we have pneumothorax, pneumonia, pulmonary embolism, pulmonary edema, pleural effusion, cardiac tamponade, and all metabolic causes or metabolic acidosis like DKA, lactic acidosis, and aspirin overdose. For chronic causes of dyspnea more than 1 month, like pulmonary causes like bronchiectasis, emphysema, and COPD, pulmonary fibrosis, whatever the cause, occupational, cryptogenic, connective tissue disease, and also drugs causing pulmonary fibrosis, extrinsic allergic alveolitis, all kinds of lung malignancies like primary lung cancer or secondary or metastatic lung cancer, pulmonary hypertension, either primary or secondary, and secondary pulmonary hypertension like caused by interstitial lung disease, recurrent pulmonary embolism, and COPD. Also, cardiac causes can cause chronic dyspnea, like myocardial ischemia, valve disease, and like mitral stenosis, myocarditis, cardiomyopathy, and of course, congestive heart failure. Other causes like anemia, sepsis, obesity or ascites, kyphoscoliosis, and neuromuscular disease like muscular dystrophy and motor neuron disease, and also sarcoidosis. Drugs that can affect the lung and causing dyspnea, like ACE inhibitors, non-steroidal anti-inflammatory drugs, anticonvulsant, beta blockers, even glaucoma drops, beta blockers, antihypertensive medications, antibiotics, antifungal, antiretroviral medications, digoxin, and interferon. Some medications can cause lung fibrosis, like bleomycin, the chemotherapy, busulfan, methotrexate, procainamide, amiodarone, and nitrofurantoin. To start history for dyspnea or shortness of breath station, as we know before, set, dialogue, and closure. For the set or introduction, we start with greeting and introduce yourself and explain rule. Hi, I'm Dr. Hadidi, SHO of Internal Medicine Clinic. Then confirm patient detail, name and age. So you are Mr. Muhammad and you are 56 years old. Build good rapport. Please have a seat. May I sit beside you? And explain note-taking during the station. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Then agree the agenda. I have received a letter from your GB stating that you have shortness of breath. Is it right? This is for the set or introduction. Then for the dialogue, we'll start with the presenting complaint. So can you tell me more about your breathing problem? Is it difficult when you try to breathe in, like in cases of foreign body, or when you try to breathe out, like in asthma or COPD? Is it chest tight? Does it take an increased amount of effort to breathe, like in asthma? Do you feel that your breathing is rapid and shallow, like interstitial lung disease? And do you feel as if your throat is closing or that you are about to suffocate? Do you feel tingling in your fingers or around your lips? Do you feel that you are unable to take deep breath or that you cannot fill up your lungs fully? These all questions, if yes, mostly this is panic attack. Where were you going? What were you doing when it started? For example, lying down, running, walking, lifting something. This all as a present history. To analyze the presenting complaint, by the numeric Odbara. So we'll start with the onset. How did it start? Was it sudden or gradual? Duration. When did your shortness of breath start? How long have you been breathless for? Progression. Is it getting better? Is it getting worse or staying the same? Does it come and go, fluctuating, or is it constant? How many times do you suffer shortness of breath exacerbation per month or for progression? After that, aggravating factors. Do you feel short of breath on lying flat, which is called orthopnea in congestive heart failure? Does lying on one side make you short of breath, like in pleural effusion cases? Can you exercise for some time before getting short of breath, like exercise-induced asthma? Is there a history of any recent chest infections or viral illnesses? Does your shortness of breath worse in winter? Does your shortness of breath vary during the day? Is it worse during the day or during the night? Is it worse during weekdays or weekends? What about during holidays? Like occupational asthma increase like weekdays. Other aggravating factors, does your breathing only get heavy with activity like anemia or heart disease? What brings it on? Like triggering factors like cold air, exercise, feathery or furry animals, pollen, dust, chemicals, irritants, and smoke. For progressive factors, is there anything that makes it better? Does your inhaler help at this time? And what's your technique like for using the inhaler? Associated symptoms. Many associated symptoms can be with dyspnea. Do you have fever, night sweats, loss of appetite, fatigue, or weight loss? This is signs of pneumonia, cancer, or TB. Do you have any heart racing, ankle swelling, or fainting, like in congestive heart failure? Are your lips, face, or tongue swollen or itchy, like in anaphylaxis? Is there history of possible foreign body or vomiting, aspiration? Has there been a period of loss of consciousness? Uh, this might indicate aspiration pneumonia. Is there any skin lesion or joint or eye problems, like in sarcoid or connective tissue disease? Do you have cough, and when did it start, like in asthma, pneumonia, GERD, pulmonary embolism, and COPD? Other associated symptoms, do you have any chest pain, chest tightness, or pain on deep breathing? And what comes first, chest pain or breathlessness, like myocardial infarction, pneumothorax, pulmonary embolism, and pericarditis? Do you wheeze? And when did it start? Is there any associated flushing or diarrhea, like in carcinoid syndrome? Do you bring up any phlegm? How much phlegm do you bring? What is the color of the phlegm? Is it frothy? Do you have stridor or noisy breathing and upper airway obstruction? Do you have heavy snoring or nocturnal apnea or morning headache or falling asleep at work or in front of TV or while driving? This all indicates daytime somnolence and obstructive sleep apnea. Other specific questions, severity. We have to identify severity of the dyspnea. How often do you use your inhaler? How many prescriptions do you go through? Do you have a peak flow meter at home? What are your normal readings like, or usual readings? How far you walk on flat ground before you feel breathlessness? How many flights of stairs are you able to climb? What stops you? How many pillows do you use at night? After finishing present history, we'll go to past history, medical and surgical history. Have you ever been hospitalized, and for what reason, and for how long? Have there been any previous episodes like this one? What was the diagnosis? Have you had a recent period of prolonged immobilization? Have you ever had blood clot in your leg or in your lung? Do you have high blood sugar, high blood pressure, or high cholesterol? Do you have a history of cancer? Do you have a history of heart problems like myocardial infarction or congestive heart failure? Do you have history of any lung problem like COPD, asthma, or interstitial lung fibrosis? Do you have any autoimmune or rheumatic disease like rheumatoid arthritis, ankylosing spondylitis, and sarcoidosis? Have you ever had any abnormal chest X-ray? Have you had any lung disease in childhood as recurrent chest infections or tuberculosis? Is your immune system depressed? Have you ever had exposed to tuberculosis? Have you had the BCG vaccine or Mantox test diagnosed with tuberculosis? Have you ever had treatment for TB? What medication were you given and what was the duration of treatment? Were you compliant to medications? Was the TB therapy directly observed? This all to identify causes for dyspnea like TB and if compliant to medication. Have you ever had very high blood glucose with acidosis, diabetic ketoacidosis, or have you ever had renal failure? After past history, we'll go for medications and allergy. Do you use, it's very important to ask about nebulizer or inhalers. Do you use home nebulizers or inhaler? Do you know how to use your inhaler correctly? Have you ever been taught how to use them properly? Have your symptoms improved upon its use? Do you have any side effects like hoarse voice, which comes with steroid inhalers, or heart racing and the tremors comes with beta agonist inhalers? Have you recently started taking any new medications that might worsen your breathlessness, like ACE inhibitors or beta blockers? Have you ever been exposed to medication with lung side effects like amiodarone? Have you ever been exposed to radiation therapy? For female patients, are you taking birth control pills, which is as a pulmonary embolism risk? Do you ever or do you have any known allergies to food, insects, or latex? Have you had any anaphylactic reaction before? For family history, is there any family history of asthma or atopy, like eczema, allergic rhinitis, hay fever, and asthma? Is there any family history of heart disease, and at what age? Are there any hereditary lung condition run in your family, like cystic fibrosis, Cartagnar syndrome, and alpha-1 antitrypsin deficiency? Is there a family history of tuberculosis? After family history, we'll go for social history. Start with smoking. Do you smoke and how much you smoke? And what is the age you start smoking and for how long? We need to calculate the smoking index pack per year. And if the patient stopped smoking, when did you stop? Travel history. Have you traveled overseas in the past year? Have you had any tropical illnesses like TB or histoplasmosis? Do you have any animals at home, any birds, any parrots? Also, alcohol history. Do you drink alcohol? Illicit drugs. Do you use any recreational drugs? After that, occupational history is very, very important in dyspnea station. What do you do for living and or what's your occupation? And have you had any previous occupation? What tasks are performed at work and what materials were used? Have you ever been exposed to asbestos, coal dust, organic material, or other toxins? Is your workplace or home near any building sites, like risk of asbestos or aspergillus spores? Then effect on daily life and job. Has your breathlessness interfered with your usual activities? Are you able to get out of house? Can you climb the stairs? Where is your bed or bathroom? Who does the shopping, washing, and cooking for you? Have you had any days or time of work or school? Is your sleep disturbed? What can't you do physically that you would like to do? Does the use of inhaler in public embarrass you? How does the breathlessness interfere with your life, like walking, working, and sleeping? These all are very, very important questions before going to ideas, concern, and expectation. Ideas, what do you think might be causing this problem? Concern, are you worried about this being anything in particular? Sometimes they tell you, I'm worried it is a cancer. Expectation, what do you think might be best plan of action? For closure of the station, we summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Is there anything else we haven't discussed that you feel is important? And so to create a list of problems. So I think you have heart failure, which causes this difficulty of breathing, especially when you lie flat. Then plan the next few steps. I will examine you first. We may need to do some tests in the form of blood test and electrocardiogram for your heart. This can be done on outpatient basis. Then I will decide whether to admit you or not. Counsel on health promotion, like smoking is not good for your health, and I am going to arrange another meeting to help you to quit if you wish. Is there anything unclear you need me to clarify? And at the very end, thanks the patient by name. Thank you, Mr. Mohammed. Thank you. And these are other presentation on our channel, free medical courses. Please subscribe and like our channel. Thank you so much.